Hello everyone, my today's topic of discussion is about hepatitis B serology marker. This is a very important topic of discussion. It is very confusing when our student, this topic is very confusing, but somehow I could understand this topic, and I'm going to make you understand about this topic. So first of all, what is hepatitis B virus? Hepatitis B is DNA virus or RNA virus? Obviously, hepatitis B virus is a DNA virus. It's a DNA virus because it has a DNA polymerase enzyme which is going to help for the replication of the virus. The DNA polymerase enzyme is present in the core. So if you draw hepatitis B virus, like the first is that there always a surface and some middle portion area and a core. Within core there is nuclear material, some nuclear protein, nucleic acid is like the enzyme present is the DNA polymerase enzyme. The nuclear material is the totally DNA. So if we talk about the marker is two things, antigen and antibody, which is going to appear if fast, and what condition, which type of antigen or antibody appear is our topic of discussion. What type of antigen first appear and what type of antibody first appear, when we get which type of antibody we get when the person is immunized, or there is any past infection or recent infection. So today we will discuss, I'm going to discuss all details about the marker without mnemonics, with easy understanding. So not too much bok. I am going to elaborate this thing in a funny way. So every virus has a surface. I'm going to draw a surface. This is surface, and there is a surface protein. Always surface has surface protein, and this protein is hepatitis B surface antigen. This is hepatitis B surface antigen. So hepatitis B virus for marker, if we talk about the antigenic marker, is number one is hepatitis B surface antigen. I'm going to write this in this way for easy understanding. Hepatitis B surface antigen. S for surface. I'm going to leave the second antigen now. Third antigen is the core antigen. Core for C for core. So hepatitis B core antigen. Now I am going to add some color. This green color is for hepatitis B E antigen. So the position of this E antigen is present between the surface and the core protein is known as hepatitis B E antigen. And obviously for this type of antigen in our blood, because of immune response, there are presence of antibody. Again color change, antibody. First, for hepatitis B surface antigen, the enemy is anti-hepatitis B surface antibody. So लिख लो anti-hepatitis B surface antibody. Not too much writing, only AB. For hepatitis B E antigen, the antibody is anti hepatitis B E antibody. For hepatitis B C antigen, for core antigen, dushman is anti hepatitis B C antibody, core antibody. Okay, now which antigen? What do you think? Antigen came first or antibody? Which marker came first? Which marker came first? Suppose someone has infection of hepatitis B virus, and which marker came first? दिमाग लगाओ. So first of all, it's about the logic. Antigen, obviously antigen will came first. That there is infection, viral infection, virus, foreign body is antigen. Antigen came first. So the surface, always surface. बाहर का जो surface है सबसे पहले वही दिखते हैं, वही ब्लड में आते हैं. तो hepatitis B surface antigen came first. But when it about the immune response of our body, which type of antibody came first? It is hepatitis B core antibody came first. The first one. क्यों आ रहा है फर्स्ट मैं बता रही हूँ. Hepatitis B surface antigen, then hepatitis E antigen. The role of the hepatitis B antigen when it is presence in blood when there is the viral replication. The significance of hepatitis E antigen is replication. So when there is replication, when the patient is in acute infectious stage, in acute infection there is viral replication, and more replication, more presence of hepatitis B antigen in blood, so more severity of infection. So the amount of the hepatitis B E antigen is proportional to the infectivity. Clear? Yes. So always in acute infection, hepatitis B E antigen is present, and it's the significance of this antigen is linked about the viral replication. Now next thing, hepatitis B core antigen. ये जो कोर एंटीजन है ना, ये बहुत ही शर्मीली टाइप की है. मैं बाहर नहीं आऊँगी, मैं अंदर में ही बैठी रहूँगी. It does not appear in blood. So if we test the viral marker for hepatitis B core antigen did not came, बहुत ही ज़्यादा शर्मीली है. Does not appear in blood. Very very important. But मैं तो नहीं आऊँगी, पर मेरी इम्यून रिस्पॉन्स तो ज़रूर होगी. तो मेरी इम्यून रिस्पॉन्स के लिए मैं बना रही हूँ, मेरी दुश्मन को मैं प्रोवोक कर रही हूँ, वो है एंटी हेपेटाइटिस बी कोर एंटीबॉडी. So this is the antibody which came first, which is this is the active one, this is the first one, first immune response by anti-hepatitis B core antibody. Simple. The first antibody. अब इस भाई साहब के भी दो टाइप के हैं. अब बारी आते हैं एंटी. मैं एंटी ऐसे लिखूंगी, कोई प्रॉब्लम है किसी का? नहीं है, मैं ऐसे एंटी को लिखूंगी. एंटी हेपेटाइटिस बी कोर एंटीबॉडी two types, IgM and IgG. IgM type of antibody is seen in when the person has recent infection, when the person has an acute infection. So the IgM type of anti-HBC antibody found in blood. And when there is a chronic infection, when the person is carrier, then IgG. IgG is the long lasting antibody we get in the hepatitis B. For anti-hepatitis B core antibody, we get IgG type in case of it is the long acting antibody. IgG always long term में जाते हैं क्योंकि इसमें क्रॉनिक कंडीशन में मिलते हैं. IgM जो है वो एक्यूट कंडीशन में मिलते हैं. पेशेंट का रिसेंट इन्फेक्शन हुआ और मुझे सपोज अ पेशेंट who is positive for IgM type of anti-HBC antibody, that means the patient has a history of recent infection. Okay, मान लो तुम्हें वैक्सीनेशन हुआ हेपेटाइटिस बी का, तो तुम्हें कौन से टाइप के एंटीबॉडी मिलेगा? बोलो. हेपेटाइटिस बी वायरस के अगेंस्ट जो इम्यूनाइजेशन होते हैं, जो वैक्सीन मिलते हैं, वैक्सीनेशन रिकॉम्बिनेंट टाइप के होते हैं, तो उसमें जो प्रोडक्ट यूज़ करते हैं वो है हेपेटाइटिस बी सरफेस एंटीजन. So obviously for hepatitis B surface antigen, we only get positive for anti-hepatitis B surface antibody. So suppose the person is immunized with hepatitis B surface antigen. The immunization, the vaccine is made from hepatitis B surface antigen, and by immune response, the production of the antibody will be anti-hepatitis B surface antibody. So when all antibodies are negative but the anti-hepatitis S is positive, then obviously think about the person, whether the person is immunized or not. Yes, the person is immunized. Now this is the boring chart. I am going to elaborate this for simple way. Suppose the person is hepatitis B virus infection, so which one is going to positive? Again I told, for the recent infection, for the acute infection, obviously this IgM type of anti-hepatitis B core antibody will be present, and another is obviously any infection, hepatitis B surface antigen will be there. So this thing is positive for acute hepatitis B virus infection. Early acute hepatitis B virus infection, when ओनली हेपेटाइटिस बी सरफेस एंटीजन, क्योंकि सरफेस का सबसे पहले आते हैं, सबसे पहले आते हैं, तो सिर्फ सब नेगेटिव है, हेपेटाइटिस बी सरफेस एंटीजन सिर्फ पॉजिटिव है. अगर कोई रिजॉल्व पेशेंट ठीक हो गया, रिजॉल्व एक्यूट हेपेटाइटिस बी वायरस इन्फेक्शन, देन द एंटी हेपेटाइटिस बी सरफेस एंटीबॉडी विल बी देयर and anti-hepatitis B core antibody, but the type is IgG, not IgM. IgM is only for acute hepatitis B virus infection. So the IgG is for resolved acute hepatitis B infection. पेशेंट ठीक हो गया, पेशेंट पूरा एकदम ठीक है, तो तब मिलेंगे एंटी हेपेटाइटिस बी सरफेस एंटीबॉडी एंड एंटी हेपेटाइटिस बी कोर एंटीबॉडी IgG टाइप. ओके, एंड और कहाँ मिलेगा एंटी हेपेटाइटिस बी कोर एंटीजन? व्हेन देयर इज द क्रॉनिक इन्फेक्शन, दिस इज पॉजिटिव, एंड अलॉन्ग विथ फॉर क्रॉनिक इन्फेक्शन hepatitis B surface antigen is there. For infection, hepatitis B surface antigen is there, should be present. Again anti hepatitis B core antibody, the long term course, chronic cases, chronic infection, chronic hepatitis B infection. So IgG type of anti-hepatitis B core antibody will be there, and the hepatitis B surface antigen will be positive. When the person is not infected, so none of them will be positive for the non-positive marker. Non-infected but prior vaccination for hepatitis B virus. So just few seconds ago I told only hepatitis B surface antibody will be positive for if the person is immunized. Okay, this is quite simple. So just a quick recap. Hepatitis B virus is a DNA virus, and three types of antigen is there: hepatitis B surface antigen, hepatitis B core antigen, and hepatitis B E antigen. E antigen, significance of the E antigen is when it presents means there is replication, means there is infection, and infection is acute recent infection and presence of the hepatitis B E antigen. Okay, and for the antibody, the important antibody, the first appearance of the antibody, if the first appearance of the antibody is the anti-hepatitis B core antibody. Okay, remember that point, not the surface antibody, it is the core antibody. Core antigen is the core antigen can appear in the blood? No, never. Core antigen can never appear in the blood. It is Shermili type of antigen, never in the blood. But for the core antigen, there will be always presence of antibody. Is the first antibody anti-hepatitis B core antibody. Two type of anti-hepatitis B core antibody. The first one is the IgM type. The presence of the IgM type of hepatitis B core antibody signifies the person has a recent infection, and IgG type signifies the person is the chronic infection with hepatitis B surface antigen is positive, along with the surface antigen is positive, means the chronic infection. And if the anti-hepatitis B surface antibody is present along with the IgG type of hepatitis B core antibody is present, means the person is resolved condition. Person is now okay, person is now well, resolved acute hepatitis B infection. And when the person is vaccinated, only hepatitis B surface antibody is positive and other things are negative. Okay, simple. Thank you.